Namaskar. We would like to welcome you all on behalf of Independent Research Ethics Society at the milestone of 2536. Thank you. Thank you very much for joining. Today, we are celebrating one day in advance, Bastille Day, Bastille Day, Bastille Day. What is the pronunciation? Suparna ji will guide us. French National Day, it is French National Day, being celebrated on 14th of July every year. We are one day in advance. So France National Health System, this is our topic. And milestone again, I am reminding 2036. So thank you. I would like to welcome Dr. Suparna Sanyal Mukherjee Madam, and I would like to welcome Dr. Sekat Kumar Vasuji. Both are pillars of AYUSH Samriddhi, experienced expert orator. So without wasting much time, I would like to request Dr. Suparna Sanyal Mukherjee Madam for her valuable guidance. Dr. Suparna Sanyal Mukherjee.
Thank you, Sharmaji. Thank you very much for giving me such opportunity. And this topic is really very interesting and very enthusiastic. And it is also thought-provoking topic which we are emphasizing upon. Basically, if we can say that this the healthcare system of France, especially the traditional healthcare system, which is very interesting. That's because it has been observed, and WHO also declared that the France healthcare system is the comes first in 191 countries of the world. So that's what is over there. How it has been stood first, because what is the technological orientation, what is the medicinal aspects, what is the perspectives, at the same time, what is the traditional methods, because generally it has been observed that the France are observing and depending upon on the traditional healthcare system. So if we can look back to the France healthcare system, and if we can emphasize upon the France healthcare system, so it is the population in France is considered to be in the good health. They are always in good health. French consumers are shifted with their good health system. They consult their doctors more often, are admitted to hospital more often, and purchase more prescribed drugs. So they practice the healthcare system such a manner. If you can boast on the medicines and the diseases, if you can kept in abeyance of these diseases, the uses of this medicine, the prevention is better than cure. So that's why they can kept in abeyance their diseases, and they are very cautious for their healthcare system. The France has the structured their system to be an ideal synthesis of the solidarity and the same time the liberalism. Though the state imposes strong price control policies on the healthcare system and the medicinal values, the finds that health services are rationed to patient. So this the rationing system they are practicing in their healthcare system. The system lies between Britain's nationalized health services, where there is too much rationing, and the United States competitive system, where too many people have no health insurance. The France healthcare system is planned and organized in relation to the need expectation and which expected to of the population. And the populations are very cautious, and they are very rational, and they are very thought provoking. They have a strong, the structured and the strong commitment to the universal, obligatory, and the solidarity method of healthcare delivery. There are many perspective mechanisms built in so that the cost sharing effect and the cost sharing does not prevent people from receiving the necessary care. The system also provides a great deal of respect for patients' choice. It ensures equitable geographical coverage and efficient interaction between the different types of people. That is the in case of this hospitalization, the hospital sector. If we can go to the primary healthcare system, there is also they are getting proper benefit, the proper medicine, the proper healthcare pattern. And this in line with this principle, the social solidarity, the coverage of basic healthcare system, we have been observed that which is very universal. The healthcare system is universal, both citizens and non-citizens residents. If you was living over there, you will be looked after by the French government and the contribute according to their means and obtain the services according to their needs. Each person with social insurance benefit from a protection that they get the finances according to their needed and resources against the risk consequences of illness independently. Especially the age specific ratio they as maintained and the age or state of health. In some instances the statutory health insurance system provide 100% coverage, and this case of the perennial and the parental matters care and the cost related to the industrial injury and the long-term illness where social security pays a whole cost of lifelong essential medicine and medications in this the case of this the diabetic patient, the cancer patient, the heart disease patient. So any kind of the non-curable diseases, they will taking care of this, the very protection. And the, some pharmaceuticals use digital information system to deduct sums reimbursed by social security. In some cases, it has been observed that the many are also linked to certain contemporary and complementary insurance schemes. So, which is secure and ensure equity, patient that exempt from the payment when expenditure exceeded approximately $100. And this the hospital state exceeds the 30 days, they will give you the proper medication and proper system and proper support where you can taking care of your patient in the home itself. So that's why it is a very important, and the French healthcare system also provides a high level of resources and higher volume of service provided, which covers prescriptions, the product of this homeopathic, then Ayurvedic, then cures, then nursing care, and the cash benefits, and to lesser extent of dental and vision care also be cured by this the healthcare system, and which is very free and very rational cost. So here it is very important part of the IUS system where the French healthcare system stood first in the world and 191 population, 191 country where the people are suffering and where the people are not getting the proper benefit. The French healthcare system will give you the proper benefit where the IUS has the wide aspects and which can spread among the French system, the healthcare system, where the yoga therapy, then the Unani, Siddha can boost the healthcare system also because they also respect the homeopathic treatment too, where the Ayush can be introduced by this healthcare pattern and system, where they can be visualized and where they can be benefited more than this rational pattern which are introducing and which are practicing right at this moment. So the healthcare system, which is based on a single NHI fund, which is a part of the France extensive social security system, which initially it has been molded and this after the German sickness fund fostered by the Chancellor Bismarck, and the French healthcare system had evolved into a blend of Bismarck and the beverages. So public and private concept is also introduced in this French healthcare system, and centralization and decentralization is also have the direct effect in the French healthcare system. So hence it has been observed that the health insurance is funded by the contribution based on the professional learning of the people, and the tax saving is also over there. And the several years health expenditure has been growing faster than the gross domestic product. The French health expenditure also minimize and also merge in the system orientation, and the payment system is dominated by the solo based fee for service private practice for um, ambulatory care, and the public hospital for acute institutional care. That means when you are suffering any kinds of diseases which can be tailored in home by the uh, uh, daily practice and the ambulatory practice. So the hospital will come to you and they will taken care of. So the rush of the hospital could have been avoided by this franchise system. And if there is any acute cases, the hospital will taken care of you. They will send the ambulance to you and they will taken care of, because you are covered by the insurance, and the insurance is giving you the proper practice of the healthcare system. So it is very interesting and very scientific in that cases, and where you will get the social security. And if and it is very cost effective. If your insurance would not be covered the total factor here, so they will recover it, because it will be returned back to you, because the cost is very effective over there for basically the health. Because if your health is well, that means you will get the life expectancy, and which has been respected by the French people, and they are very good for their healthcare system. And this current healthcare system is a product of long history of development of its self establishment, and this also giving you the proper benefit of your health and proper respect of your health, and they are taking care of you in the each and every aspect where is needed, and you will be looked after by your health with the French healthcare system, and it is covered in all and each and every respect of your life sustainability. So that's why it is very important part of their healthcare system, and where there is plenty of scopes of the Ayush which can be introduced in the French healthcare system, and which can be the part of their healthcare system. And Ayush has the wider range for exploration of the healthcare system of the France. Thank you very much. Thanks for giving me such an opportunity to say something on this auspicious time and momentum. Thank you.
Thank you very much, madam. Thank you very much. मैं आपका ज्ञान का सम्मान करता हूँ। बहुत बहुत शानदार आपने स्पीच दी। आज सैकत जी कहीं फंस गए हैं क्या?
शेखर जी को इंटरनेट का कोई प्रॉब्लम चल रहा है, और वो have reported it. So if it is that means good enough to enter into it, then he will enter. Otherwise, it is very stringent to him to enter into here. So he has called me up and he has explained the problem which is happening.
I would like to communicate on Bastille Day. What is the pronunciation? I am confused. Bastille Day, Bastille Day, Bastille Day, because English persons are generally silencing few words. So I would like to communicate the importance of Bastille Day in France. In France, there is always a national holiday on 14 July. It's called Bastille Day. The Bastille was a fortress prison in Paris. On July 14, 1789, it was broken by French citizens because they were fed up of being ruled by a monarchy, kings and queens. Before this, kings and queens were ruling over France. They were unhappy about the way their king Louis XVI ruled them, so they overthrew him. This was called as the French Revolution. The French people wanted to rule for themselves, and so from then on, France became a republic. A republic is a form of government that puts the power to make decisions in hands of its citizens. The guillotine. The guillotine was the revolution's prime instrument of execution. Over 30,000 people were executed through this machine. This was the machine. They included priest, king and queen, and even Robespierre and some of his best friends. Executions were a public event, almost like fight in the gladiators in the Colosseum in the Rome. During the Great Terror, people could not even be arrested for not showing a lot of excitement for it. Robespierre is probably the most well-known leader of the French Revolution. He was nicknamed as incorruptible because of his loyalty to the revolution. He was the most powerful man in France and the leader of the Reign of Terror who made a list of all the people they wanted to execute. His life ended with his execution in 1794. Then King Louis XVI. At the time of revolution, King Louis XVI ruled France. In revolutionary France, the king was tried for crimes against the people. According to the rules of New French Republic, he was guilty and was executed. France had done the unthinkable and murdered their king. Marie Antoinette. She was the queen of the time of at the time of revolution. After the death of her husband, she experienced many changes. She was no longer a rich queen, but a prisoner of the republic. Her son was taken away from her and was raised by the prison. He later died when he was only 10 years old. She died at Gurutan. Above all, Bastille Day or the 14th of July is the symbol of the end of monarchy and the beginning of republic. The national holiday is a time when all citizens celebrate their membership to a republican nation. It is because their national holiday is rooted in the history of the birth of republic that it has such great significance. To everyone in France, Bastille Day today represents the solemn military parade of the Champs-Élysées in Paris in the presence of the head of the state, the president of the republic. The Champs-Élysées decorated with the flag of 14 July, you can see here. It is also a holiday on which each commune holds a local dance and fireworks. Tricolor, the French flag is also tricolor. The blue, white, and red French flag took shape during French Revolution. The three colors represent Republic's three ideals: agilite, fraternite, at liberty, equality, fraternity, and liberty. Very simple. The Eiffel Tower was built in 1889 to celebrate the 100th anniversary of Bastille Day. Wow. This is information for me also. After 1789, 1889, to memorize this revolution with after century, the Eiffel Tower was built. Thank you. Thank you very much. Happy Bastille Day to all France celebrated. सुतपा जी आप कुछ बोलेंगे? सुतपा वर्धन जी हमारे साथ हैं. Would you like to say something? Or we can conclude the webinar. सीपी शर्मा सर हैं क्या? चलिए, गुड नाइट, हैप्पी बर्थडे, गुड नाइट, गुड